Risks to patients, staff, and organizations are prevalent in healthcare, therefore making it necessary for an organization to have qualified healthcare risk managers to assess, develop, implement, and monitor risk management plans with the goals of minimizing exposure. There are many priorities to a healthcare organization, such as finance, safety, and most importantly, patient care. To handle such crises, an effective risk manager should be trained and able to handle various issues in multiple settings. They must identify and evaluate risk as a means to reduce injury to patients, staff, members, and visitors within an organization. Risk managers work proactively and reactively to either prevent incident or to minimize the damages following an event. Recently published research discovered that prolonged urinary catheter use is the leading risk factor for catheter-associated urinary tract infections. Based on this information, a risk management plan should be implemented. First line of business, accountability. Every physician should be required to regularly evaluate the catheter. Risk management must stay up to date on relevant information in their organization because research results can prove contradictory to presumptions that would otherwise shape risk management practices. Managers should conduct organization-specific risk analysis to determine potential risk. The analysis should identify what could possibly happen. How likely is something to happen? How severe will the outcome be if something did happen? How can the issue be mitigated on the forefront and to what degree? What could be done to reduce the impact and to what degree? What is the potential for exposure or what cannot be proactively avoided? The team should focus on patient safety, mandatory federal regulations, potential medical error, existing and future policy, legislation impacting the field of healthcare. Many patient risks can be reduced by adequate training, encouraging strong communication among staff members, providing counseling services for those working with patients, and conducting competency assessments. Employees should be educated in all aspects of risk management strategies, including how to prevent and respond to risk, how to complete documentation. It should be accurate and kept, which can be studied and used as a reference. Departmental coordination keeps everyone on the same page, which expedites the risk management process and adds protection against malpractice claims. Employees must take steps to prevent what is avoidable. Employees must also react to risks that are unavoidable with great speed and accuracy. They should know how to report an incident to reduce risks to organization. And they must also learn how to handle complaints to also reduce risk to the organization. You must keep in mind risk management plans are specific to different healthcare facilities. While avoiding potential financial consequences is one concern, patient needs are generally the priority. The hazards of not preparing for potential issues can have significant long-term effects. Neglecting to have comprehensive risk management plans in place can compromise patient care, increase liability risk, and result in financial losses. Using analysis results, risk managers can compare the likelihood of different adverse events along with their impact and rank potential risk in terms of severity. Plans for mitigating risk and handling them appropriately can then be developed. Risk management plans also undergo quality assessments so the interventions and actions proposed are addressed as real potential issues. Once a strategy is in place, it is monitored and modified as needed. Risk management is important for all types of organizations, but it's especially important in healthcare because human lives might be on the line. A good healthcare risk management plan can reduce patient health risk as well as financial and liability risk. As always, regardless of an industry, a good risk management plan needs to be developed, implemented, and monitored.